Hey, future medics, Tina here, your medic mentor, and today we're talking about one of the most common medications you'll hang in the back of the ambulance, normal saline. Now, normal saline doesn't have a fancy brand name that you need to remember. It's a basic crystalloid IV infusion that is isotonic in nature. Now, isotonic means that it has the exact same salt concentration as the fluids in your body, which makes it very safe to give in most situations and very versatile. So, how does it work? Well, it replaces lost fluid volume, thus increasing the vasculature and maintaining perfusion. We're going to use this in hypovolemia, shock, burns, keep IV lines open, but also you might see this used to mix up medication infusions, dilute medications, flush them through lines. It's a pretty versatile medication. The dose depends on what you're treating. For general purposes, for an adult, we give boluses of 500 to 1,000 milliliters. But in trauma, you may see something called permissive hypotension. That means that instead of raising the blood pressure as high as we can get it, we want to keep that patient around a systolic of about 90 or a MAP of 65. We're going to do that for a couple of reasons, but the main one is that normal saline doesn't carry clotting factors or hemoglobin. And so while it does help maintain that perfusion, which is incredibly helpful, we don't want to dilute your whole blood and the clotting factors that are in it, especially in our trauma patients. Normal saline is given IV or IO. And with a medication this basic, you might think that there's no downsides, but that's actually not true. We're going to want to use this in caution with our heart failure and renal impairment patients because their bodies do not do well with the influx of fluids. Also, with otherwise healthy patients, we can see electrolyte imbalances, dilutional acidosis, or even fluid overload. So while there's no hard contraindications for giving normal saline, you don't want to hang a bag in the back just out of habit. Know what you're trying to treat and trying to do, and do this with intention. Now here's your takeaway. Normal saline is your go-to basic infusion, but just because it's basic doesn't mean it's harmless. We're going to use this with intention, monitor your patient, and always know why we're using it. You're doing a great job with these drug cards. I'll see you for the next one.